So one of my questions is about the Genesis system that has started and is finally, honestly, the first thing that's ever tracked me from one base to the next, so that's good progress. But one of the hitches that I found is I have a child who's over the age of 13, and he had some medical results, and I could not access them, so I tried to get him his own access to Genesis, and then was told he can't have a DS log on because he's not over 18. Thankfully, he doesn't have a lot of medical issues, but at Cavassa Hood now, I was told I had to walk down to the Soldier Center every time I wanted to access his records to find out what happened, which is fine for a child that doesn't have a lot, but we have some really serious medical needs in the military community, and some families that are already working full-time jobs trying to get the care for their children, and I'm worried about when they hit 13, how they're gonna be able to access that without adding to their workload.
Yeah, so I'm happy to take that question. I have the opportunity to address this about once a month, every time I talk to the command spouses at the pre-command course. And so I will add your voice to those voices as I go back to my friends at DHA and emphasize that this is still an issue. It's such an issue that my husband made a video about this. I don't know if it's still on YouTube. I don't know if he was told to take it down, but he was.
Funny though.
It's funny. Patty got to see my entire morning routine because my husband videotaped my entire morning routine as a story. Yes. Did I mention he's really invested in family care? So here's the issue with it is exactly as you identified. It's a DS log-on issue. So MHS Genesis requires that DS log-on for patient access. And DS log-on can't be given to a child under 18. There is a law that is what's getting in the way of you being able to access your child's records, that we have made DHA and OSD aware of the impact on our family members and their children and patients, that gets this weird window between the age of 13 and 18 that the child can't get into the record and the parent can't get into the record, and that you have to go down to the patient administration office each time and request the records. I get how frustrating that is, and I apologize that you are having to deal with that. I am advocating at the DHA level to ask for a solution to that, even if it was a one-time or what have you. I've said we are happy to entertain solutions. We are very reasonable people, actually. Soldiers and their families are used to doing hard things. We don't mind hard. We just don't like things that really don't make sense to us and we can't fix. So I will continue to advocate for you in that space.